Ms. Jones. We've done your medical history and went over that, and we also did your x-rays and reviewed those.
Okay.
And you remember at the beginning of your appointment, the doctor came over and did an exam on you.
Yes.
And he did confirm that that suspicious area we talked about earlier was the start of a dental cavity. Okay. So what we're going to do now is I'm just going to ask you some questions. It's called a carrier risk assessment. And you can kind of give me some feedback on these questions, okay?
Sure.
I see that you're a single mom of 3.
Yes, I
am. So
am.
that means you're really busy.
Yeah, very busy.
Okay, but you make it in regularly for your dental appointments.
Yeah, I
every 6
try to
months?
get in here every 6 months.
Okay.
Yeah.
All right. And from your medical history, I see that you take an anti-anxiety medication.
Yeah, I do.
Okay, do you notice that your mouth can be a little dry at times, or you drink a lot more water?
I noticed that my lips are not as moist as they were, so I'm using chapstick quite often. So,
Okay.
would that be caused from that, or?
Well, it could be the start of what we call xerostomia. You could have a little bit of
Oh.
that going on, and we can kind of get you started on something that can kind of help with that.
Okay.
Okay.
Great.
Do you live in a fluoridated community that you know of?
I assume so. I live in Land O'Lakes, in Pasco County, and I'm pretty sure they're fluoridated.
Okay. From what I understand, Pasco County is not a fluoridated community, so you're
Oh,
not
really?
getting fluoride through your drinking
Oh.
water there.
I didn't know that.
Yeah. So, what about you use a fluoride toothpaste?
Yes, I do.
Okay. How often do you brush a day?
I try to brush twice a day, but sometimes, since I'm working late as a RN, sometimes I come home and I fall asleep before I can brush them. So, unfortunately, I don't always get to do it.
Okay. Do you use a fluoride rinse?
No, I don't use mouthwash.
Okay, so you're just getting a little bit through your toothpaste.
Yeah.
That's pretty much it. Okay, so we're going to definitely have to get you on something that's going to help you out a little bit more with fluoride.
Okay.
Okay. What about your dietary habits? I mean, do you snack a lot between meals because you work a lot?
I do. Sometimes I'm just grabbing things in between patients, so they're not always the healthiest snacks.
Okay, so you eat a lot of like cookies.
And I drink a lot of coffee and sweet tea, for the caffeine too.
Okay. How many glasses of sweet tea or coffee do you drink a day?
I probably have 3 to 4.
Okay, so you have a lot of sugar intake.
Yeah,
So
probably too much.
we definitely need to talk about changing that and probably cutting back on some of that.
Okay.
Okay. And just talking over those things and going from your medical history and your x-rays and doctor confirming that you do have the start of a dental cavity, we're going to do a fluoride treatment on you today in the office.
Okay.
Okay?
What would that help with if I already have a cavity?
Well, since you already have the beginning stage of the cavity, we want to give you a fluoride treatment to kind of arrest that cavity
Oh.
before it goes into
Okay.
a bigger stage where you can get into your pulp, which can cause you to have a lot of pain, and then you have to do a root canal and
Oh.
post and crown, which can be a little bit more expensive.
Yeah.
You understand?
Yeah.
So since you're a working mom,
Yes.
busy,
I don't have time for that.
we're going to give you a fluoride treatment
Okay,
today.
sounds good.
And I'm also going to recommend that you use this ACT fluoride rinse at home.
Okay.
Try that out, and
Okay.
since you don't have fluoride in your water, and then continue to use your fluoride toothpaste. And when you come back in, we'll do a reassessment on you, see how you're doing, and see if that curious region has kind of remineralized itself.
Okay.
Okay. Do you have any questions for me?
No, I don't. Thank you.
You're welcome. Let's get started.
Okay.